Feel free to start whenever you're ready.
Okay. Excellent. Well, thank you all so much for joining us. We are so excited to be hosting um, this webinar. My name is Alasia Letford. I am one of the co-chairs of the Qualitative Research RIIG, and so happy to have all of you here with us. And Dauncey, would you like to introduce yourself as well?
I'm fine. I'm Dawn C. Epen. I'm the chair of the Qualitative RIG. But thanks, Alicia, for introducing Dr. Graff and moderating the session. Thank you.
Yeah. So today we have Dr. Caroline Graff, or Dr. Carolyn, I apologize, Graff, joining us from the University of Tennessee Health Sciences Center and the College of Nursing there. She serves as the PhD program director and has extensive experience as an educator, researcher, and journal reviewer. Dr. Graff's research expertise spans quantitative, qualitative, and mixed methods, with a focus on children with or at risk for developmental and chronic health disorders. She also has an interest in the experiences of caregivers and family members, as well as health professionals, including students that work with these children. Government and foundation, as well as institution grants, have provided significant funding to support this research and the programs resulting from the research. Her research is complemented by teaching doctoral courses in nursing theory, philosophy of science, qualitative research methods, and mixed methods research, as well as mentoring doctoral students in nursing and health policy. She's received local and national awards recognizing her research, teaching, and public service. And she's currently the co-principal investigator of the Shelby County Relative Caregiver Program. Dr. Graff has published in more than 100 peer-reviewed journals, published 22 book chapters, and 2 books. She's presented her scholarly work at more than 300 international, national, or local meetings, and more than 100 of those were invited presentations. Dr. Graff is a member and a fellow of the American Association on Intellectual and Developmental Disabilities and supports professional organizations through membership in the American Nurses Association, American Public Health Association, Council for the Advancement of Nursing Science, International Society of Nurses and Genetics, Mixed Methods International Research Association, Sigma Theta Tau International, and Society for Longitudinal and Life Course Studies, Society for Pediatric Nurses, and SNRS, the Southern Nursing Research Society. So we are so excited to have her joining us and sharing her expertise. Today, her talk will help us to really understand the nuance and the distinction of qualitative interviewing and therapeutic interviewing, including strategies to guide researchers like us who have clinical expertise in identifying and responding to therapeutic issues that may arise when conducting qualitative research. And with that, we will turn it over to Dr. Graff.
What an introduction. Oh my goodness, thank you. Oh my, I just needed 3 sentences, but thank you so much. I feel like I should apologize for some of that because I belong to organizations mainly to support them. I believe in the work they do. And so I can't do everything in every organization, but I can contribute to supporting them to continue the work. So anyway, that was one of the things I heard when you were talking. So I thought, oh my goodness. So yes, the other thing I'd like to say is just for the sake of communication between you and me, if you have a question that you would like to, or point that you would like to make, a question that you would like to ask, or point you would like to make, please raise your hand. In smaller groups, I would just say, interrupt me, because I do that. I mean, I'm thinking and thinking, and I think, oh, here's this point I want to make or question I want to ask. Since there's 38 people here, I think that's going to be a little difficult. So
my understanding was you just pick at least two.
Hey, Lori, thank you for muting.
Okay. Okay. So please raise your hand and, we'll get to a question. So I will talk about myself, kind of how I'm at this point of wanting to talk about this. So I will say right now, I'm in the midst of working with a team of people who are conducting an intervention study with people here in Memphis around medication adherence. They are conducting qualitative interviews after the intervention has occurred, 1 month after discharge from hospital and the intervention that has occurred, and then 12 months later. So what I'm seeing is the people who are conducting the interviews are medical students or people who are interested in becoming medical students. And I'm being struck with how their interview style is so much like a physical assessment, doing a history and physical exam. And so, and I've had this sense about myself before, so I just wanted to spend some time basically going through this, because I've read quite a bit about this, and just decided when I was asked about a topic, I thought, yes, this is what I'll share. So, and it's quite meaningful to me right now. So the outcomes, or actually the topics I'll cover, I'm going to begin with discussion of healthcare provider interviews, then the whole idea of just interviewing and what is it. I will mention the 5 qualitative approaches that I talk about in the qualitative research course I teach to doctoral students. We'll talk about research interviews and therapeutic interviews, and therapeutic tensions arising during research interviews. And then we'll end with some strategies to guide the researcher who's engaged in qualitative research interviews. So, whoops, sorry. So to begin with, I looked at actually a textbook. My neighbor, a faculty member right next door to me, who's a strong, seasoned ICU nurse and nurse faculty. And I asked her what she thought about healthcare provider interviews, and she immediately grabbed the Bates Guide to Physical Examination and History Taking book and said, here you can see what we think about history and doing a history in healthcare. So I went to the book and looked at it, and basically Bates talks about, or it's really Bickley and Szilagyi, write about a health history as a conversation with a purpose. So if you think about meeting with a patient and say you're looking at doing a history and physical exam, so we've got this conversation that has a purpose, and the primary goals for the healthcare provider are to listen and really improve the well-being of the patient through a trusting and supportive relationship. And so for the patient, what we want is the patient to feel connected to us and deeply heard and understood. And that's, again, considered at the heart of healing. So there's this notion that when we do a history or interview with a patient, we're getting at, you might say, the heart of healing. And so for clinicians, a deeper relationship then in turn enriches the rewards of patient care. And you can think about yourself and histories that you've taken when you met with a patient, and how sometimes they go so well. People, you're tuned into that patient, they're listening, and you totally you might say you get what they're talking about, or you really understand it. There's an easy flow there. So I'm going to move on here. So here, I just wanted to talk about interviewing and talk about, again, what an interview is. And these are some of my favorite people. I've given you authors here who I really like, Rubin and Rubin, but they write about social interaction. An interview is a social interaction based on a conversation. And Brinkman and Volley write, an interview is where knowledge is constructed in the interaction between the interviewer and the interviewee. And then a qualitative interview is attempts to understand the world from the subject's point of view, to unfold the meaning of their experience, and to uncover their lived experience. So I would just like you to think about interviewing from a qualitative research perspective. And from my notion, there are really two broad types of interviews. One is an individual interview, which you can see in the picture on the left, and the other is a focus group interview. So how many people, if you just write in chat really quick, how many people have conducted individual interviews? Yep, raising hands is great. Okay. And individual qualitative interviews. I'm sorry, I'll qualify that. Yeah, everybody. Oh my goodness. Okay, excellent. This is what we want. That's why you're here for qualitative. That's why you're here for this meeting. Okay, excellent. Okay. A few people haven't raised their hand. Okay. And yet people are going into chat. Okay, perfect. Wow.
Dr. Graff,
Yeah.
I'm monitoring the chat as well. There was a request if you could possibly, I'm not sure if you're which screen sharing you have, but if you could go into presenter mode so that it's showing just that slide and not the notes over to the right, I think it would be,
Okay.
they
Okay.
would be a little bit easier for them to see.
Okay, let's see if I can do that really quick under share. Advanced sharing options. Okay. Okay. You may have to guide me on that because I'm
Yeah,
not.
do you have two screens right now?
Yes, yes, yes. I see what's going on. Okay.
Mhm.
Yes, let me stop this other screen. See if I can get out of this without. Okay. So I'm taking that one away. And let's go back to. Okay, here we go. Whoops, shoot, Carolyn. It still goes into that weird place. Let me just see if I can turn that screen off and see if that makes a difference here. Oh, well, it
It
still
was in the
does.
slide mode. I think that's what shows up on the slide mode.
Okay.
Yeah.
That's weird.
Okay, well, that's okay. We'll continue from here.
Okay, sorry. I could stop share and try again if you would like. That might work better. Let me try that. I'm going to stop share really quick and share again with my other screen turned off. Okay, it's still there. Shoot. Okay. Sorry. Okay. Okay. Well, we'll move ahead. I'm really
Okay,
sorry.
yeah, that's okay.
Okay. All right. So I just again want to get to this point of types of qualitative interviewing. So we tend to interview individually or focus group interviews. And again, this is where in coming to Memphis, I'll disclose to you, I came to Memphis from Kansas City, and was immediately, once I arrived here in Memphis, asked to develop a study of grandparents who have custody of grandchildren, and immediately went into this mode of, oh my goodness, how do I collect data? So we did basically a quantitative study looking at the health of grandparents who have custody of grandchildren, physical and mental health, and then moved to this notion of follow-up, getting a report in to our funder and getting, again, funding that has continued here for almost 20 to 23 years, which has been phenomenal that we've been able to continue this funding with support from the state of Tennessee. It's been a really great project. But as we move through from the initial quantitative study, we needed to do more work to find out in more detail how this project would really be received by the caregivers. And so to me, here I'm this white woman from Kansas City who's come to Memphis. And so the way to get at this was really focus groups. And there were times many times I was not the facilitator of the focus group, but certainly the person who was helping with the data transcription of the interviews, analyzing the data, but again, with a team of people who we worked together really hard on. So I'm saying I found focus groups here from a qualitative point of view based on the project we were focused on. Focus groups really gave us the information we needed to have, which was really important for us. Okay. So the 5 qualitative research approaches I like to focus on, and this is coming out of Cresswell and Poth, but again, a narrative research, and again, I'm sorry about the text on the side, but that's right, basically what you can see over there. Narrative research, phenomenological research, grounded theory, ethnographic, and case study. And again, just a quick reminder, narrative research focuses on the lived and told stories of individuals. Types of narrative studies include life history and biographical study, ethnography, and oral history. Phenomenology or phenomenological study describes the common meaning for several individuals of their lived experiences of a concept or phenomenon. And then grounded theory, the aim of grounded theory is to either describe an existing theory that hasn't really been raised up yet, or to generate a theory. And finally, ethnography, well, not finally, we've got case studies, but ethnography or an ethnographic research focuses on examining the patterns of behaviors, beliefs, and language among a culture sharing group. And then finally, case study research involves the study of a case or cases within real life or contemporary context or setting. So you can see that, again, we're looking at various approaches to qualitative research. These are by far not all the approaches that we use in qualitative research, but it's a way to kind of begin thinking about the approaches we use. The other thing just to think about, which I've not really spent a lot of time on, is how we interview using these different qualitative research approaches. So you can see in narrative research, typically, we may well have one individual. We may well interview 1 or 2 individuals. We may interview a family or a small group of people. And phenomenology, we expand our sample, increase our sample a bit more, grounded theory, and on and on. Case study, we may have one individual, we may have groups of individuals, but you can see how interviews will be dictated to some extent by the qualitative approach that we use. I just want to make that point. So again, going back to qualitative interview, I really like Brinkman and Volley's approach in terms of the stages of an interview, inquiry, or interview that a study that includes interviewing. So they write about creating themes for the inquiry or the study. So we need a theme for the study. We then design the study. We conduct the interview, transcribe the findings, analyze the data, and then we verify validity, reliability, and generalizability, or in qualitative terms, some qualitative terms, transferability. And then we write the report of the study. So this is quite interesting to think about from the point of view of therapeutic interviews. And this is not only coming from Brinkman and Volley, but others write about therapeutic interviews. And essentially, many people write that Sigmund Freud was the person who developed therapeutic interviews, and that his approach was later developed and, you might say, refined by Carl Rogers. So there's thinking that therapeutic interviews have influenced how qualitative interviews have been conceived and conducted. And then here again, Carl Rogers went on to develop what's called an open client-centered interview. So Rogers used a non-directive approach as a method for social research that allows respondents to express themselves freely in the company of an accepting and empathetic researcher. And so Rogers was actually looking, I think, at himself as a researcher, as a person going in to get at this information that he wanted. Therapeutic interviews aim for change, through an emotional, personal interaction instead of a logical argument used in a philosophical dialogue. Although the main purpose of therapeutic interviews is to assist patients in overcoming their suffering, a side effect is the production of knowledge about the human situation. And I find that fascinating because here we are thinking that, again, from a therapeutic interview perspective, we're seeing that the thinking is that therapeutic interviews, again, are to assist the patient with whatever suffering. And you can think about the work Freud did and also Carl Rogers. The effort is to assist the patient, the individual, in overcoming suffering. And then a side effect would be the production of knowledge about the human situation. So Brickman and Volley say that therapeutic interviews and research interviews may lead to increased understanding and change, but the emphasis is on knowledge production in a research interview and on personal change in a therapeutic interview. Does anybody have any questions at this point or comment? I know there's a lot in the chat. Any quick points or questions?
There's a couple in the chat that I'll go ahead and bring up, and then we'll see if there are others.
Okay.
One is related to thinking about the approaches of qualitative approaches. Is where would qualitative descriptive fall among those 5 approaches, or would you consider it an approach in and of itself?
Yeah, that's a great question. Personally, I consider it an approach in itself. I like qualitative descriptive
Yeah.
research. Yes. So I would definitely, that again, and the person I think of immediately is Marguerite Sandalowski, Dr. Sandalowski's work. So that's my quick response.
Yeah, absolutely. And then when we're thinking about kind of, as you had outlined, sort of that process of a qualitative study, does the researcher thinking about a theme prior to the interview process? I think that was a couple of slides back, just that first piece of the thematizing the inquiry or study, like
Right.
what exactly does that mean? Because I think part
Right.
of what we're thinking is in the analysis piece is when we're pulling out themes. So how does that work?
Right, that's a great question. So I see this really more as identifying a theme or purpose. So I'll use the word purpose there. It's clearly not bringing themes in at that point. I mean, in terms of how we normally think about our coding moving, and I'll use Johnny Saldana's approach of codes, categories, and themes. I mean, we're not going that way. In the beginning, the first step is to really identify what it is we're focusing on. What's the purpose of this study or inquiry? What are we aiming for here? And we have to bring it in. We have to narrow it in or bring it in. Yeah.
Those are all the chat questions. Thank you so much.
Perfect.
Were there any others? If you don't mind just raising your hand and I don't see any others
Okay.
at this point.
Okay, great. Okay, let's see here. So here we go with Freud. Freud regarded the therapeutic interview as a research method, which I think is fascinating. And he says it's indeed one of the distinctions of psychoanalysis that research and treatment proceed hand in hand. So you can see some of the thinking or just think about, what was going on with Freud in terms of the interviewing and the in-depth interviewing that he would do in terms of psychoanalysis and how that could be, from his perspective, regarded as research, which is kind of unnerving to me, I have to say. But I think I'm open to looking at how we've come to where we are in qualitative research based on some evolution from where we've been. And again, the notion of Freud is quite interesting to me, or it's a new way of coming at things. Here we go again, the psychoanalytic research interview. This is the approach that was used, the individual case study, open mode of interviewing, an interpretation of meaning, temporal dimension, human interaction, pathology as a topic of investigation, and then the instigation of change. So again, it's quite interesting to think about this type of research interview. I'm not saying I accept this as a qualitative approach, but I think it's quite interesting to think about. Okay. So here we go to think about therapeutic and research interviews. So again, the purpose of the therapeutic interview is to facilitate changes in the patient. Knowledge is acquired from the patient, and that knowledge is a means for instigating personality changes. The general knowledge of the patient situation gained through the psychoanalytic process is a side effect of helping patients overcome, again, their neurotic suffering. And this is, again, coming from Brinkman and Volley's work. But it's that notion that the general knowledge of the patient situation is to some extent a side effect. So the general knowledge might be the environment the person's living in, the resources they have in terms of their own person. You might say community resources, individual resources, their education, etc. We gain more insight into that, but it's again a side effect. They're considering it. So in a qualitative research interview, the purpose is to obtain knowledge of the phenomenon being investigated, and any change in the participant is a side effect. So it's almost like a flip. It's almost a turn. So the change is, again, a side effect. And I think that's what I'm personally aware of as I've conducted focus groups here, probably more so here in Memphis than before coming here. I'm seeing potentially change in the participant as a side effect. We weren't holding the focus group for therapeutic purposes, but I'm seeing and have experienced circumstances within focus groups where people really gained insights into their health or their experiences because they were sitting around a table with other people who were having the same types of experiences. So qualitative interviews as research instruments and social practices. Again, Brinkman and Volley refer to two approaches to qualitative interviewing that include the broad phenomenological approach and discourse analysis and conversation analysis. So in the phenomenological approach, that approach aims to get as close as possible to a precise description of what people have experienced. And again, you can think about the 5 approaches and other approaches that we can discuss in qualitative research. These folks are saying we really have 2 broad approaches, the phenomenological approach and the discourse analysis and conversation analysis approach. And then approaches such as discourse analysis and conversation analysis really focus on how people express themselves through the form of an interview and give accounts about the situation they find themselves in. And I've certainly done that in the work I've done. I haven't claimed my work was actually a discourse analysis or conversation analysis, but the approach comes at one in which people express themselves and give accounts about the situation they find themselves in. So here's a way to look at this from, you might say, 2 conceptions or principles of qualitative interviews. And the paradigmatic background for one is phenomenology, grounded theory. The other is discourse analysis, conversation analysis. And you can see here the conception of interviewing from a phenomenological or grounded theory perspective, or that particular paradigm. It's the conception of interviewing is the interviewer is indeed a research instrument. And then the second perspective is under discourse analysis and conversation analysis. It's more of a social practice, and social, I'm meaning the interaction between people more so, between participants and potentially even others outside of that interview. The conception of interview data under phenomenological grounded theory, under that particular conception is more reports, interview data as a resource. Whereas again, the other side, discourse analysis, conversation analysis, there's accounts, interview data as topics. So again, under analytic and analyzing, we're after in the phenomenological grounded theory perspective, we're looking at lived experience, the what, whereas under discourse analysis, conversation analysis, we're looking at the how, a situated interaction. And the main challenge for the phenomenological grounded theory approach is validity of the interviewee reports. So we're after, you know, are these reports from the interviewee valid? And how do we determine that? Under discourse analysis, conversation analysis, we're looking at the relevance of the interviewee accounts. Does anybody have comments? I mean, I'm going to keep going on this for a little bit, but it's a different way to look at this and think about this. And again, coming at qualitative interviews is where I'm coming from with this.
You have a question. Excuse me, I'm sorry. I can't find my raise hand button. I was looking for it.
Sure, you're fine. That's okay.
When I'm looking at the slide here, what's the basic difference with the analytic focus, the what, and the how? Do they ever overlap?
I think they do. I think they do. Yes, and they overlap within a given study, because there are times we're asking what questions. We've developed an interview guide to ask for the what, but we may also be getting at the how somebody does something or how something occurs. So absolutely, I think they do overlap. And that's a downside, I think, for this. And that's where we'll come ultimately, in my belief, that we have an overlap with therapeutic and qualitative research interviews. I think we have an overlap. And what you're asking here, I think is showing some of that. There is an overlap here with this. I don't know if that helps. Vanessa, Dr. Monroe, I'm sorry. Okay.
Okay, thank you.
You're welcome. It's a great question. We need somehow as human beings to compartmentalize things and put things in tables. You see, these people have done that.
Right.
And to some extent, I appreciate that. I'm sorry. Did you have a comment?
I was agreeing. I was like, yes, I think we like to do that. But then reality is that it all, you know, when you're interviewing someone, they're gonna, whether you've solicited it or not, they may get at the how, right? They may share that additional information.
That's the
as well.
beauty. Yes, absolutely. I'm sorry I'm interrupting you, but I get excited about
There
it.
is another, I'm sorry, Alicia, if you missed it. There's another chat, question in the chat, if you want to.
Yes, yeah. I was just about to get to that, and there's a question from Adam Booth who's looking at kind of curious. It says curious about the application of qualitative descriptive approach as a way of factually examining a participant's words in the context of a case study. Do you think that it's possible to kind of integrate? There's this integration of approaches, and would that be kind of acceptable to do that?
Honestly, I think it depends on the topic, the subject. What is the question, the research question, the qualitative questions? That's where I would go first to make a decision about whether or not using a case study, I'm thinking about one person as a case, but we also could have a hospital as a case, a unit in a hospital as a case. I mean, could have different cases. So, but to use that and use a descriptive approach, I think I'll have to spend some time thinking about that, because, yeah, I think it's a possibility. I do. I just have to do a little bit more thinking about that. That's a great question. We can come back to that. I don't know if that helps, Adam, but anyway, okay. Okay. Any other questions in the chat? Okay. 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 So when researchers approach qualitative interviewing primarily as a research instrument, again, the validity of the interviewee's reports become a significant methodological problem or issue. Interviews typically focus on the past, so the capacity of participants to remember what they've experienced must be considered. And I really appreciate this. I'm working with a student now who's interviewing patients in the intensive care unit. And I'll say after they've experienced a stroke, my initial thought was, oh my goodness, this is too early. Why are we doing this? They're not long interviews, but the notion of memory has come up and remembering and how people do remember. So luckily, I just found a really great article on memory that I shared with her last night, in fact. But I think that's another piece we have to think about is, we're asking, and again, in healthcare, we're asking about the past. I mean, often versus the present. And occasionally we get into the future, but it's more of looking at the past and the experiences a person has had, a patient has had. So looking at guidelines to help the interviewees improve recollection, here's some examples. Allow time for recall and assure the interviewee that this is normal. And you'll often, again, in focus groups, I've seen this over and over where I'll ask a question, again, from my interview guide. I'm just following along and asking, a question that's just perfect. I'm moving along. And inevitably, someone will bring up a different topic, or they will bring up a topic that was discussed earlier. And it's like they now remember what they were going to say or contribute because of that particular time. They've had time to recall and bring it up. Or the question I'm asking now is really one that encouraged the person or helped trigger their response at a slightly different time. But it's quite fascinating to see what participants do. Again, provide as the interviewer, we can provide concrete cues. For example, we could say the last time you were talking to a physician or nurse, rather than saying a communication experience. And so that's what's happening in the study I mentioned to you that I'm involved in. These patients are engaged in an intervention study. And so we have to be really specific about when we ask a question. We want to know how they interacted with the pharmacy tech, how they interacted with the nurse, how they interacted with the physician, rather than saying, tell me about your communication with healthcare providers. They like, which healthcare provider? Who are you talking about? That kind of thing. And then use typical content categories of specific memories to derive cues, such as ongoing activity, location, persons, or other people's and the patient's own affect. So again, looking at specific categories or content categories of specific memories that can be useful in deriving cues. And you can ask for recent specific memories, just something that has happened. And that is actually what's happening in the study the student is doing with patients who've experienced a stroke. She's staying really close in to topics like, do you recall when the ambulance came to your home? What was your experience like there? What was it like? And patients are giving just incredible information about those experiences. Use a relevant extended timeline and landmarks as contextual cues. So you could say, when you were working at such and such a place, when you were working at FedEx or whatever, to aid the recall of older memories. And then ask the interviewee for a free and detailed narrative of the specific memory. So by free, that's just open and flowing narrative of the specific memory. If you've got the time, if that fits with your particular approach that you're using. And then I want to come to this piece, which I think this is my own thinking about where we are with therapeutic interviews and qualitative research interviews. So my experience has been that qualitative research interviews, and again, this is coming from living here in Memphis, conducting focus groups and some individual interviews, but I'm finding that the interview itself, the focus group interview or the individual interview, can actually be in itself therapeutic. And I can leave a focus group, and I'll just call it a meeting, but because we often meet in churches or places in the community, we meet in a room that's convenient to the participants. It might be a community agency, community group, whatever. And they have come together, we have all come together in this room, and as I ask questions and people share, there is just an incredible connection that can happen and occur, almost like a bond between the people who are in the room, to the point that I always have extra paper and a pen in a folder. So when people are sitting there after the focus group, people get each other's phone numbers, they write down information they've learned from each other. So it becomes, to some extent, it's moving over to this therapeutic side, in that it's becoming quite useful to the person. And it's probably more going this way from qualitative research interview to therapeutic interview. I'm not a psych mental health person. So I'm not into that mode of conducting therapeutic interviews to move into this qualitative research interview. But you heard some of my comments about Freud and Rogers. So there's been that thought that they were doing research as they were doing their therapy or psychoanalysis, particularly with Freud. So, but I think there are, to me, it can be like a tension, and it can be a positive tension or a concerning tension, where there's, you might say, a negative type of experience that's going on for the participants. So I'm interested in what people have experienced here in this group. It's a large group. I'm really thankful that you all are here. I'm overwhelmed actually at seeing 43 people here today. So I'm accustomed to a group of about 10 people, so we can go around and share each other's names. We can't do that here. But if anyone has any thoughts about tensions you've experienced during research interviews, either, write them in the chat, or if you want to raise your hand, that would be great. I'm just curious about your experiences with those.
We do have a couple of questions in the chat. One comes from Jennifer Stevens asking, are you aware of any research conducted using qualitative interviews that looked at therapeutic responses from the interviews? So kind of like almost a qualitative study that's looking at the therapeutic, impact of the qualitative interview.
Yeah, there is a study I'll mention toward the end here that was close as I could find on a quick review of literature. But for the most part, I would say no, I'm not aware of. I mean, specifically to the question you've asked, that's been asked, no, I'm not aware. From my point of view, this is an area that I think we need to look at. We need to spend some time thinking about as we move forward with qualitative research. I'm also convinced, I teach mixed methods research, and I'll disclose for myself, I'm a graduate of the University of Kansas PhD program. My advisor loves statistics, and I'm really more of an intuitive sort. So I've read through 2 qualitative courses, loved both of them, love nursing theory. We have Margaret Newman is from Memphis. I spent time with Margaret Newman before she passed away. So I'm kind of a qualitative sort of person, but my advisor kept guiding me to take statistics courses, which I did. And I came out of my PhD program convinced that we had to use both. We have to have both. And so that's why I teach mixed methods. I've, spent time at the Mixed Methods International Research Association, etc. Talked with John Cresswell about the work he did and, in terms of the textbooks he's written, etc. So I'm sorry, I'll go on and on about that.
No, you're fine. I see Jennifer Stephen has her hand up, so I'll let you go ahead and add if you have anything additional to say about that question.
Okay.
Thank you. I was just thinking that, many times, I guess in the consents, we're talking about the risks that they have from participating in the, like whether it might be like recalling of some, past experiences that might not have been, positively remembered or that sort of thing. But I've never really thought of it as like the benefits of, having recalled those experiences in a qualitative interview or, talking about their lived experiences and the benefit of that. So, thank you.
You're welcome. You're welcome. And conducting multiple focus groups in the community. And again, I'll say, I was one of 2 white women in the group, and there were the rest of the people in the focus groups were African-American men and women. And so, it was one of those things initially where I thought, are people going to talk to me about this? Of course they will, if you listen, and it was like, oh my goodness. I remember one man who came in to talk, the diagnosis was diabetes. So we were focused on, patients who were having problems controlling their diabetes. And so people sat around the table. I think that was a large focus group of about 10 people. So this man sat right beside me. I'm, very careful about, I'll say I use Kruger and Casey's approach to focus group interview. So anyway, but this man sat to my left, and other people, as we start moving through the discussion, he became the expert. All of a sudden he spoke up and said, I've been diabetic since I was 12 years old. And the man was probably middle-aged at the most. So he had exceeded everybody else in terms of abilities and experiences. And he wanted to announce that he was the expert. It was just, it was wonderful because people started talking more to him, but he was very pleased. I mean, I thought, what an interesting thing to be really proud of your diagnosis, but he was so helpful. It was fascinating to, I'm going off a little bit here, so I think I better stop.
You're fine. It is. Well, this is why we all love qualitative work, right? There's another question in the chat. It says, regarding the previous slide, so the slide before this, thinking about kind of recall and the ability to recall certain experiences given kind of how much time has passed. Is there a recommended time frame for participants to recall experiences? In the chat, this individual is saying that they've noticed that sometimes there are participants who can have a really strong memory, and even though a long time has passed, they remember it very well. So is there a particular time frame that's recommended if you're asking questions, or does it just vary?
Yeah, I think it depends on the topic. I mean, what your research question is. I mean, in terms of the length of time that you would go back. I'm not aware of any length of time. And this notion of memory is actually somewhat new to me. The student I mentioned to you who is interviewing patients who've had a stroke, and some of these patients are 24 hours post-stroke or 24 to 36 hours post-stroke. So she's not asking questions about 5 years ago and what they did. She's asking in the immediate time period. She's not, I mean, and that whole interview guide had to be carefully put together to avoid adding stress to the patient who's still there in the hospital. I mean, she's interviewing people in the hospital setting. So no, I'm not aware of a time period. I think it would depend on your topic and the study that you're doing. Yeah. I mean, a narrative approach, you likely would go way back. Sometimes that's life course across the life span of a person. But yeah, sorry.
So kind of with that, the next question in the chat is with that in mind, how do you manage if the interviewee is not able to correctly recall past events? So for example, how would you manage if they indicated information that you as the researcher know is not correct, kind of about a past event?
Yeah. Yeah.
How do you manage that?
Yeah, that's a great question. Again, depending on the setting I'm in, there are times we do go back to participants and share our views of what was shared. I'll quick say this: in focus group interviews, when I do focus groups, there's always someone assisting me when I facilitate, or if someone else is facilitating, I'm an assistant. And so I can sit back and listen to what's being said in the focus group. And then as facilitator, I can say, okay, now Diane, would you summarize what you heard here? Would you summarize what people have said here today? And that person who's assisting the facilitator, the assistant, will actually summarize comments and findings. And that's one place we could get at some of that business of accuracy. But again, I think we'd have to be careful with that, because sometimes people appear to, might well be in what our eyes is inaccurate or giving information that's not true, but it may well be that we don't know the whole story. I mean, I would be cautious about that, because there may be a bigger story there. So the piece of information that we're getting from the person at this given time, that may well be as accurate as they can share. And I'm thinking psychologically, they may not be able to go beyond that. So they'll give us a piece of what's happening. So I think I would probably not do that in a big group. The other thing we've done is we've actually taken summary or findings back to the participant and asked them, to verify this. Is this true? Is this what you would call was being said? Another student I worked with, I'll have to say, she actually asked the participant if they would like to read the transcript of their interview. And so she would give the transcript back to the interviewee, and they would review it. And no one made corrections. I mean, it was really fascinating, but it seemed to help people as they, spoke about this topic that, they read about the topic they were being examined on, or that was the focus of the study. And I'll just say the topic was infertility in healthcare providers. So it was helpful. I think it was helpful to the participants to read those, transcripts. So that's another way you could get at it too.
Yeah, it's a great way of member checking for sure.
Yeah, exactly. Yeah.
There's some additional comments in the chat, just kind of sharing experiences with that tension. One individual mentions that in interviewing Latinx immigrants with type 2 diabetes, the interview gave them a safe space to talk about their condition and challenges in managing their condition. And then another individual shared that the tension of staying person-centered and empathetic in the qualitative research interview space without leaning too much into the therapeutic space, specifically when doing interviews as part of like an RCT. So being cautious not to add in an additional interaction with the subset of participants who participated in those qualitative interviews. And kind of, I think that sort of gets at that idea of like, is the interview becoming an intervention in and of itself, and does that impact then the actual intervention that you're doing, especially when you're doing like a mixed methods study? That subset of people who are participating in that qualitative interview process, are they then kind of having better outcomes as a result? And it's not necessarily due to the actual intervention, but to the qualitative interview.
Right. Yeah.
And then we have another comment that says, yes, in interviewing pregnant women, it's very hard not to lean into shared lived experiences with these women and not be too therapeutic, especially when these women are being very vulnerable and open. And so kind of that separation, I think this is sort of getting at that separation of being the researcher, but also being an individual who's gone through kind of lived experiences too. And like, where do you draw that line, and kind of that tension between that tension that's there for sure.
I'm sorry, I just looked at my clock, my phone, it's 2:54, so I'm talking too much. I think we started at 2, so okay, thank you. I'm going to go through these last comments here. So strategies to guide the researcher: a carefully planned study, thinking through as much as you can about how the study is going to be conducted, and thinking about some of what we've been talking about. The other thing I'm in the midst of learning much more about, actually from Sandra Thomas, who's over at UT Knoxville. I love her approach to phenomenology and bracketing. And that whole business, that's something we can do, even though bracketing tends to align with phenomenology, we can still bracket if we're using a different approach. And then the whole notion of journaling. So the student I mentioned who's focused on patients who've had a stroke, post-stroke, she has been journaling and found that to be quite useful to her. And then the notion of debriefing. And I think as students, and I'm in that kind of academic setting, you know, students can debrief with me as I'm as an advisor or a mentor to the student. And again, just the journaling in itself can be quite useful in terms of a debriefing process. So strategies to balance relationship and rigor, there's again that notion, and this is actually the study I mentioned. This is what I found. Someone asked about any work that's being published on this area. This was it's not direct, but it's kind of a study that was actually done that speaks about some of what we've been talking about, some awareness of that notion of the interview, the interviewee, and that relationship between the interviewer and the interviewee. So here's this, again, relational focus, active engagement and curiosity, focusing on the relationship between the interviewer and the interviewee. So that can be really important to think about, particularly when we're interviewing one-on-one. I think it's a little safer somehow in focus groups for people, but when we're one-on-one, it can be the relationship we have. If we're a healthcare provider and this is a patient and we're in the healthcare setting where they receive care, it can be challenging for people to be, again, completely open. But use open-ended questions, neutral questions without leading language, establish trust and rapport between the interviewer and the interviewee, and view the interviewee as the expert. I say that at focus groups I conduct. You are the expert. And again, I mentioned the man who said, I've been diabetic since I was 12 years old. He was the expert. There was no way. And he wanted me to know that. So it was very important. And it was a perfect way for us to move through that focus group, because people learn then that their experiences that they were sharing were really important to us. Dress professionally, not overly formal. Avoid jargon or slang, and use normal conversational tones. And again, begin the interview with a conversation, attempting to establish commonalities and build trust. Provide a brief explanation of the study and the study procedures. People need to know what we're doing and why we're doing it. And you all do this. We do this anyway. We give, hopefully, the IRB, our Institutional Review Board, approves how we approach the patient when we begin interacting with the patient and even getting consent. Demonstrate a non-judgmental attitude, again, maintaining a conversational tone. Practice active listening. And then follow-up questions are often as important as the core questions. So sometimes those follow-up questions, we hear things that are unexpected to us. And so sometimes there's a question to be asked, sometimes there's not. It may just be listening, so we can learn more about what the person has to share with us. So these are the references I've shared. I just want to share with you. Brinkman and Volley, I will tell you, are European. They're in, my goodness, I think the Netherlands. Even though I'll be whatever, biased or whatever, they're excellent. Their work is excellent. I really like their approach to, in particular, this notion of a research interview. They speak about that and in terms of interviewing. And then, whoops, I was going to share, this is the article, the third one down, Semi-Structured Interview in Primary Care Research, a balance of rigor and relationship and rigor. So this is, people are kind of writing about some of this in the context of a study they're doing. I think we need to write about this in a bigger sense. We need to address this, because I think we as researchers benefit from this as much as the participants do. And I think we need, or we may have challenges from the participants. So I'm finished. I'll stop. Thank you very much for listening.
Thank you so much, Dr. Graff. It has been such a pleasure to really dive into this and to think about this. I just want to open it up if there's anyone else who has any additional questions as before we close out.
There are many questions here. These are fascinating. You all, you've done a great job. I feel like doing an analysis of the chat box to see what's there.
Thank you, Dr. Graff. It was very informative and really appreciate all the audiences that, joined. And we have a great, audience who was very active too.
And then I believe, if I'm not mistaken, this recording will be posted on the SNRS website. Is that correct? Is Casey still with us?
Yes, that's correct.
Yes.
Thank you all for coming. Thank you for listening. This is great. You asked excellent questions.
Yeah,
We have
Lacey,
work to do. We have work to do.
just stay for a few minutes.
Yes.
Yeah, okay.
Thank you, everyone. We look forward to hosting more webinars. Be on the lookout.
Nancy, is it okay if I leave? Were you saying I should stay? Or?
No, I don't know. So how do you, thank you so much. Really wanted to say thank you. It was such
Oh,
an
you're
informative
welcome. I
presentation.
have another, I'm sorry, I
Yeah.
have another meeting
Yeah,
at 3.
thank you so
okay.
much. Yeah.
Okay, take care.
Thank
Bye.
you. Okay, so I think Casey, we will have this. Is the recording still on?
Yes, it is. I
Yeah.
will have them divided if I can.
No, I don't think we will have time for our RIIG meeting, so we can stop the recording here.
Okay, sounds good.
And then